TikTok.
3, 2, 1.
Yeah, that's better. Hello, everybody. Welcome to Fertility Fact or Fiction. I am your host, Dr. Rahi Victory, recently returned from Brussels, and I am a reproductive endocrinology and infertility specialist trained and certified in both Canada and the US. And we spend our time advocating for you so that you don't have to advocate for you. So we try and answer your questions once a week at 8 o'clock on all these multiple platforms. So thank you for joining us for the show. Next to me is my trusty friend, Tariq Ibrahim from Ibrahim Strategies Group, who is with me as always, and he usually asks the questions. I did have a paper prepared for tonight, but I'm going to skip it for this week because I wanted to actually just let you guys ask all your questions because we barely get enough time to go through all the questions as it is. So yeah, we're going to take questions straight away. We already had a bunch, and you're welcome to ask more as we go. I'm going to put the screen there, and behind me my Ferrari fell. So if you see a big splotch on the wall, it's because the Ferrari fell down. Yeah, I don't know why, but it tumbled and is now no longer a very healthy car. This is how you stick a Ferrari to the wall, but it didn't stick anymore after, how long has it been up there for? Like a good 2 years, right? Yeah.
No one gave up on us.
Yeah, it gave up. It died. So we'll fix it. Anyways, fire away with the questions. Oh, the bright lights. Thank you. Just what I needed.
Yeah.
More blinding.
Okay. Chats. Is there any link between embryo rating and autism in the child born? Also, for parents who are already advanced age who can't help this, how can we reduce the risk of autism in pregnancy?
I'm not aware of any association between autism and embryo grade, although admittedly I've never looked that up. That sounds like a fascinating thing to search. I will happily do that. With regards to age, there's nothing you can do because we don't actually know what causes autism. So because we don't know what causes it, there's no way to know how to avoid it either.
For modified material FET, what should progesterone be?
Modified natural?
Modified material FET.
They must have meant
Natural, yeah.
Yeah.
What should progesterone be on transfer day? Can it be too high? And how much PIO do you supplement with?
So we start with 50 milligrams a day, and we use vaginal and injectable. We check the progesterone after 3 days, and if you're using Canadian units, you're looking for 40 to 100, and if you're using US units, you're looking for 10 to 30. That's if you don't have endo. If you have endo, it's much higher.
How many days after trigger shot would be one DPO?
2.5. How many days? I want to make sure I understood that correctly. How many days after trigger shot
would be one DPO?
So if you take your trigger, you're going to ovulate roughly 40 to 44 hours later. So roughly a day and a half, and then a little bit more than that, but roughly a day and a half. And then the day after that would be 1 day post-ovulation. So you're really looking at 2.5 days.
Let's get some likes on TikTok and Instagram. Everybody's got to wake up with some likes. I see questions coming in, but we need the likes.
Tariq wants you to have lots of likes in order to get your question chosen. Jen is asking if heart palpitations are normal. Depends. Every time Tariq and I are prepping for the show, we both have heart palpitations.
Massive heart palpitations.
So every time I see my wife's credit card bill, massive heart palpitations.
I have the exact same sentiment.
But yeah, no. If you're talking just normally, some degree of heart palpitation can be normal as long as they're asymptomatic. You're not getting dizzy or lightheaded or anything. If you're talking in pregnancy, up to 10% of women will have heart palpitations. Again, it's normal as long as you're not getting lightheaded or dizzy. If you are symptomatic with your heart palpitations, that's more serious, so that needs a little bit more attention to detail and care.
You're being loved at this moment.
Am I? Excellent. Lots of likes. Oh, yes. Jen says, yes, I'm 7 weeks. Yeah, it's super common. 10% of women who have pregnancy will experience heart palpitations. And unless you're dizzy or lightheaded, Jen, you don't need to worry about it.
Oh, people are following our show. Weren't you guys going to try peanut butter and dates and toast on this episode?
You know what? We did not have time because I was away. So I'm sorry, but I didn't have time to get that organized. But we will try it. In fact, we were lamenting the fact this evening before the show started that we didn't have time to do that. So the two of us, however, were totally starving and desperately needed to attend to our hunger. So we did.
What's your thoughts on the Matrix test?
Matrix I used for quite some time. We probably used it for about a year and a half. I can tell you that in our hands, it didn't make a difference. And I think part of that is because I'm very blessed and our success rates are so high that it, was not really making a difference for us. But I mean, in other clinics where they're not getting the same rates we are, maybe it would be useful. I don't know. I still have yet to see any hard scientific evidence showing that it's beneficial. But I mean, there are clinics that swear by it. I just didn't see enough of a benefit to continue, so we stopped. Yeah.
What FET protocol do you recommend for persistent thin lining and adenomyosis?
Lupron, letrozole, and then a smidgen of estrogen. So Lupron and letrozole for 3 months, and then just use like 1 milligram of estrogen. That's if your body does respond. If it does not respond, you probably next best bet would be to try all the supplements and things. So vaginal Viagra, vitamin C, D, and E, baby aspirin, PRP, Neupogen, those ones. If that still doesn't work, you're kind of stuck going into something like a Gonal-F protocol to thicken the lining. And we had a patient from out west very recently who we needed to use the Gonal-F for to thicken her lining, and she got pregnant after they couldn't get her pregnant out west. So we were really thrilled about that, and it worked well. Yeah.
Thoughts on PAI1 mutation and recurrent pregnancy loss?
Yeah, so PI1 is supposed to supposedly increase your risk of clotting, and so it may be associated with an increased risk of miscarriage. There's less data on that than there is on the other ones, but the data that is there is suggestive. So I don't test for it, but when we have patients that have tested for it, we use aspirin and heparin and stuff like that.
What is metformin used for after embryo transfer?
That's good tea. I like that tea.
It's nice.
That's a good tea. What was that? Lemon honey ginseng or
something like that.
That's good tea. So metformin is used A, to prevent gestational diabetes, B, to regulate your metabolism, and C, there's some evidence that staying on it reduces miscarriage. So I don't believe in changing things that are significant in terms of your metabolism or your hormones or your overall, sort of nutritional status, that kind of thing when you get pregnant. Because I don't think pregnancies like huge swings in homeostasis. So we try and just keep you on the stuff that you're on.
From TikTok, low AMH protocols.
We use lots of vitamins, in particular vitamin D and iron. We use DHEA, we use testosterone, we use human growth hormone. I'm a believer in the microdose flare protocol, though it's very hard to find the microdose Lupron now. And then aside from that, we use not huge doses of medication. We try and use lower dosages because the high doses just don't help you very much. So I'd rather find a way to make the IVF cheaper and do it multiple times than to plow people through tons and tons of medication and get really crappy 1 or 2 eggs. That just doesn't make sense. The other thing that's really up on the horizon, and we're going to be talking about soon again, is PRP. So we made a video on ovarian PRP probably a year and a half, 2 years ago, at which point there was very little evidence that it worked except for one study. But it now does appear to be beneficial potentially based on two studies. We're still waiting for other ones to get published. So that's the only other thing you can try at this time.
We just got our Fertility results back. Can you explain partial DQ alpha?
So the DQ gene is a specific kind of protein expressed on your cells that if you share in common becomes a problem because your immune system doesn't like it when you share the same match. And so when that happens, you're supposed to do LIT therapy, LIT, leukocyte immunization therapy, if it's partial. I just had a discussion with the owner of Fertility, and he believes that you should do it even when you're a full. So we're going to try for a little bit and see if it helps. We're telling people it probably wouldn't help, but he's a strong believer that it might. So, excuse me, we're going to try that and see if it's beneficial.
Cramping the week before a transfer, normal?
Depends on what's causing the cramping. That's a good question. I mean, if you've got endo and they've loaded you up on huge doses of estrogen, that's always a bad idea. So it can be normal for that situation, but that's a bad situation to be in. If it's bowel cramps, then it's obviously got nothing to do with your protocol, or at least shouldn't. So I'd want to know what the thing is coming from. Do I drink coffee?
There you go.
Carly's asking. Yes, but only on weekends. It's a really bad idea as an OBGYN, and I learned this hard way as a resident, to get hooked on coffee, because if you get hooked on coffee, then you just constantly keep needing it. And when you need it all the time, you're like tired and then awake and then tired and then awake. And that doesn't work when you've got to be attentive and skilled and no shaky hands at 3 a.m. after you've already been working nonstop all day. And there's a complicated case you have to deal with. So I don't drink coffee except for weekends, generally speaking, or if I'm post-call and I need a little bit of a boost. But that's the only time. Otherwise, I drink herbal or green or mint teas or something like that. Yeah.
I've previously gotten pregnant with just letrozole and Overdrill and timed intercourse.
I previously got pregnant on letrozole, Overdrill, and what? Timed intercourse?
Yeah.
Great.
However,
Yeah.
it's been 3 years and we've tried that same protocol over those 3 years and also did an IUI that resulted in a miscarriage.
Okay.
We've done a ton of lab work with normal results, but I have PCOS. I get normal periods and ovulate on my own. I don't quite know where to go from here. Any advice? I've also had a saline histosalpingogram.
Yeah.
That was normal.
Yeah, come and see us. I mean, I need to figure out what's going on. So we can never really get enough information while we're on a live show, but either come see us or go see a reproductive endocrinologist, but see someone who can do all the proper evaluations and put the whole picture together. 3 years is more than enough for you to have conceived. So there's clearly something amiss, and it may not have anything to do with you. It could be your partner.
Thoughts on HCG for dudes with low quality and low count sperm?
It's awesome. It can really make a big difference. So it depends on whether your hormones are suppressed or not, but we see a lot of benefits to taking HCG for dudes who have low quality or low count sperm. Carly asked us a question earlier too.
Yeah. Do you think endo or adeno is harder to treat, or do you think they are equally difficult?
Oh God, adeno is like horrible. Endo is actually relatively easy to treat. Adeno, even surgically, it's a nightmare because you can't. Adeno, unlike endo has a margin, like you can tell where it is and where it ends. Adeno, there's no margin. It's just like it's like a tumor. It like invades into the wall of the uterus, so it's super hard to operate on.
Some previous questions from Instagram.
Sure.
Do you take insurance? If so, how does that work for American patients?
We do not take U.S. insurance, unfortunately. I wish I could, but as of this moment, I cannot. So no, we do not take U.S. insurance. Our U.S. patients just pay. Some of them have talked to their insurance companies and asked for the ability to be reimbursed if they pay themselves, but we can't take it, unfortunately. I've tried. The U.S. companies just won't let it happen.
What is the ideal endometrial lining for FET?
Ideal is minimum 8. Less ideal, but still workable, is minimum 7. Do not go over like sort of 12, 13. If it's much over that, you need to wait to bring it down or stop and start over again.
What are your thoughts on, matrix test, we did that. Any IVF success stories after isthmusal repair?
Oh yeah, loads of patients succeed after isthmusal repair. I had one patient, I couldn't get pregnant at all. We tried everything. And then she finally agreed to fix her isthmusal. She had done IVF, even that didn't work. We fixed it, she got pregnant naturally like the next month. So she didn't even need the IVF. So yeah, I mean, it happens all the time.
Does dose of NAC recommended for how long pre-stim?
We'd probably start about a month ahead of time and anywhere from 1,000 to 1,500 per day.
If 32 years old, had 2 biochemicals in 10 months of trying, would you suspect immune factor?
Oh, I need to know everything about you. I mean, that's impossible to answer, right? Anytime someone says they've had chemicals or miscarriages, I'm always looking at the whole picture. Your partner being a big part of it, your own health habits, your body mass index, what medications are you on? Do you smoke? Do you drink? Do you use street drugs, marijuana? Does your partner do any of those things? What's his sperm DNA fragmentation going to be like? Are there genetic issues? Are there hormonal issues? Is your thyroid out of whack? Do you have enough iron? Do you have enough vitamin D? So, and that's just a glimpse. There are a lot of things we look at and a lot of things we test for. So we need to know that all of that is kind of in sync and working.
Thoughts on PRP uterine wash for FET? I understand that it's done 2 days before transfer, but if you're also doing Neupogen wash 2 days before, is that okay? PR, do you recommend spacing it out?
So if you're doing PRP because of unexplained failures, it's 2 days before. If you're doing it for lining thickness, it's supposed to be a month before. And for Neupogen, we do 5 days before. I haven't seen anyone doing 2, so I can't really answer that.
Do you recommend an injection of HCG 3000 IU on the day of transfer?
3,000?
Mm-hmm.
No, that's been proven to be useless. We do HCG wash, and we use 500 units, and that's been proven to be beneficial, but we don't, nobody that I'm aware of is doing it on the day of transfer. And there are multiple studies showing it's of no benefit, so we don't do that.
What dose do you recommend for your top 5 endo supplements? NAC, ALA, CoQ10, resveratrol, curcumin.
So ALA is 600 to 800. Resveratrol is about 1,000 to 1,200. NAC is 1,000 to 1,500. Curcumin, the brand we use, is 60 milligrams. And coenzyme Q10 is 600.
Can semaglutide, Ozempic, cause any fertility issues?
Yeah, you can't use it within 6 weeks of the time that you're trying, because it is a untested in pregnancy medication and likely thought to be harmful. So do not use around pregnancy.
Challenge.
Oh.
Challenge. 41 years old.
Okay.
AMH 8.
Okay.
1 IVF. 0 good embryos. Can't afford 1 to 2 IVFs. Doctor said I need an egg donor.
Can't afford or can afford?
Can.
Okay. What's the challenge? That's easy.
She believes she's the challenge, or he believes, whatever it is.
No, we have lots of people. I just told several of my 40-year-old patients today that we had, genetically normal and or usable embryos for them. So, no, that's not a problem. I mean, the AMH of 8 with age of 40, you still have a very good chance. It may take a couple of tries, but you have a very good chance. So I would want to see it and see how we can improve on that. How many embryos did you make? What was your lab like? All of that stuff. So that's a perfect instance of reach out to us and we'll happily help you out.
Challenge accepted.
Challenge accepted. Yeah.
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 Ovarian PRP for egg quality, mixed results, unfounded or useful. Please post.
Which one? Sorry?
Ovarian PRP for egg quality.
Yeah. For egg quality?
Yeah.
Nobody's shown that it improves egg quality, just egg number. Soraya is agitated that we haven't acknowledged her. Hi, Soraya. I hope you're doing well. Thank you for staying up so late in the night to watch us. We appreciate that. That is lovely of you being a regular.
How are you and your friend, she asks previously.
Yeah, we're doing well. We were both starving, but I'm full now. You good?
Yeah.
You're very...
I'm good.
In full disclosure, I twisted his arm to the point of breaking for him to eat a little bit more than he normally eats because he's dieting. And then I made him eat some good food. So, yeah, he's a little more full than he was before.
How can you deny it? How can you deny it?
Yeah. Oh, and speaking of full, huge thanks to my wonderful patient that sent like the world's biggest box of chocolates. Like this thing is enormous from one of my very favorite chocolate makers because she did a consult with us. These are my favorite stories. Okay, I have to say this. She did a consult with us, and all I did was give her advice, and she did it in her home community. She lives in the States. And they listened to what she told them she wanted, which was our protocol. And now she's pregnant for the first time in 3 years. So, or 4 years. So yeah, thank you so much. Wildly unnecessary, but very much appreciated and very kind of you to do. She did suggest that I share it with Tarek and my office staff. And I said no. He can't, so I don't feel bad about saying that right now.
1 week at a time now. It's a 1 week thing.
Yeah, how much longer are you torturing yourself?
I'm hoping this is the final week.
This is the final week.
It really depends on the scale. Now there's a slight setback, as you're aware of.
Today, yeah.
As I say, there's a setback.
So maybe he'll have some next week if there's still any left. I'll probably polish that off.
You will begin polishing for sure.
Again, yeah.
Chances of conceiving naturally after surgery for stage 4 endo and surgery of varicocele veins.
Wow, impossible to answer. I mean, no one can answer questions like that. I need to know what your tubes are like. I need to know what his sperm quality is like. Sadly, my one greatest, horror in my life is that when we graduate, they do not give us a crystal ball. Because all of you want answers to your questions, and I wish I could just kind of crystal ball them and say it's going to be this or that, but I can't predict the future, and even more difficult when I get zero information. So I need to talk to you. You need to do a consult for me to answer a question like that.
I always answer anything as possible. Not medical advice at all.
Anything is possible. Hey, you watched your first egg retrieval tonight.
Oh yeah, that's something.
What was that like?
That
What'd
was
you
something.
think? And that one was a tough one.
That was a tough one, eh?
That was tough, yeah.
You know what? I felt it.
Yeah.
I felt it.
I don't sit.
Yeah, I saw that.
But I had to because the angle was so like.
You got to work.
I was going up.
Yeah,
That was wild.
I was blown away.
Cool,
I'll be
right?
honest. Yeah, very cool.
Yeah.
I'll be honest. I felt that completed my training as a doctor. Like I'm ready now.
Now you're ready.
I probably can't retrieve as good as you, but I definitely got the concept down packed.
If there was no risk to the patient,
Oh yeah, I'd do it for sure.
would you really?
I would, 100%.
You would go for it.
I would go for
So
it.
if there was no risk,
I would need to. I would just need to understand the feedback involved in putting in the that there's some experience required for that.
It's super tactile.
Yeah, I can tell.
You got to know.
Yeah.
And a lot of times, you got to sense where the needle is going because you
Yeah,
can't see
there's
it.
experience in it for sure. Like because I saw what you did.
Yeah.
I saw it on the screen, so I understand conceptually. Go here, stop here. But I'm sure there's feedback. Like you feel what you're doing.
Yeah.
I don't have that part
When you
yet.
get really good, as the follicle collapses,
Yeah.
I know that I'm done because there's just this little tap on the needle. It's like
Oh.
a really slight,
Yeah.
as the wall of the needle of the follicle collapses, it just touches the needle, and you just feel this tiny little tip, and then you know that you're done. It's really sensitive.
I'm telling you. I can do it. Not yet. I need some experience.
Hey man, go to med school.
I don't know if I'm taking a step forward or backwards with a move like that. But you know what? If I would do it all again,
You would do it?
I would do fertility for sure.
We
I'd
would
be an
act-
OB.
We would actually have
I would do
a
OB
riot
for sure.
of a good time being partners together.
I wouldn't do OB before understanding fertility. Before then, I always thought an OB doctor was just like a ladies' doctor. But the whole baby thing,
It's cool.
it's very different.
Yeah.
It is very different.
Yeah.
I'll give you that. Yeah. My one daughter wants to be a OBGYN.
Oh, hey. You got to bring her here all the time.
That's what I told her. Is PRP good if only the lining is thin, or is it beneficial general health of uterine?
It's probably good for the general health of the uterus because people that have unexplained failures with normally thick linings still benefit from PRP. Can I ask this question and then you can go back?
Ask whatever you want.
From Katie on TikTok, is having extreme anxiety about a pregnancy after getting pregnant via IVF normal? That's a great question, Katie. And the answer is yes, it is normal. One of my very dear friends and a brilliant fertility psychologist, Dr. Julia Sen, talked on our show once, a couple of years back, about the fact that IVF patients are traumatized. And just because you succeed, it doesn't eliminate all those years of trauma. If anything, many of them actually carry fear, anxiety into the pregnancy with them because they're so traumatized. So yeah, it's very normal. It's hard to break through on that. But with time and training and counseling, you can. So for any of you out there, and I have no financial involvement with her or anything, but if you need an outstanding fertility psychologist, we have our social worker here, Darcy. We have a fertility psychologist here as well. And then Dr. Sen is out of Toronto, but she does everything virtual as well. And she's got a PhD in fertility psychology, and she's just wonderful. So feel free to reach out to her, Dr. Julia Sen.
You were wearing a cowboy hat for a couple seconds.
I was wearing a cowboy
Somebody
hat?
sent you a cowboy hat.
I don't know how the hell I did that.
And on TikTok, you were wearing a cowboy hat and a mustache.
Excellent.
Yeah, that's something.
Was that you?
I did not send you a cowboy
I
hat.
don't even know how to do that.
I think Carly sent you a cowboy
Yeehaw.
hat.
Well, thank you, Carly. That's very
It
funny.
looked pretty good on you, I'm not going to lie.
Yeah, it was Carly. It says scent, hat, and mustache.
Yeah, you had that. That was on your face.
I don't even know how to
You
do
missed
that.
a good moment on the screen.
Yeah.
What testing would you recommend for RPL?
So sperm DNA fragmentation testing for the guy. And then for the ladies, your hormones, a full thyroid panel. So that's antibodies, TSH, T4. We do vitamin D, ferritin levels. You need a saline infusion sonohystogram to assess the uterine cavity. We do now do fertilizers testing as well, so immune and microbiome testing. You need a genetic test, karyotyping for you both, and then thrombophilia screen as well. So that's what we start with.
Stage 4 endo, 5 failed IUIs, prepping for first IVF. RE wants to do a fresh transfer with it. Have you seen any success, or is it a waste?
It's a waste. Of course it's a waste. When is your estrogen level at its absolute highest in life? There's only two situations. One, you've got a granulosa cell tumor, which is a tumor producing estrogen and gobs of it. So obviously that's a sky high estrogen level. And the other time, at the end of an IVF cycle, how much sense does it make to take an embryo, a precious, hard-won, hard-fought for, extremely expensive embryo, and put it into a location that has had the maximum amount of possible inflammation conducted on it or stimulated for it or whatever you want to say. It's absolutely insane. Nobody in general should be getting a fresh transfer, but nobody with endo should ever get a fresh transfer unless you did natural cycle IVF. Natural cycle IVF, you want to get a fresh transfer, go for it. It's fine. Your estrogen levels are no higher than they normally are. But if you're doing a non-natural cycle IVF stem, like you made 10 eggs, 15 eggs, your estrogen levels are super physiologic. you're massively stimulating your endo. It makes zero sense. Zero. There's no biological plausibility for that approach to things. So yeah, it's a massive waste. It's idiotic.
I'm taking the Pregvit Folic 5.
I ranted again. I'm sorry. I'm sorry for the rant.
It's enjoyable
It's a good
sometimes.
rant.
Yeah, I liked it.
Yeah. Pregvite Folic 5. I'm on
Yeah,
it. Yeah.
but the pink pill make my stomach sick.
Yeah.
Any other to take instead of that?
You can take any vitamin. Just make sure you're getting enough of everything. You don't have to take Pregvite Folic 5. The next best, we have a video on YouTube called The Good, the Bad, and the Prenatal. Watch that. We reviewed a bunch of them, and you can take any of those that you want. But like NFH has a good product. Centrum is fine. Materna is fine. They're all okay. They're not as good as Pregvite Folic 5, but they're close.
Is it okay to take baby aspirin today to substitute heparin because I don't feel good with it? Or is there any other med you recommend?
Oh, yeah, aspirin would be your next best choice.
Okay,
It doesn't work the same, and I would need to know why you're on heparin. And certainly if you're on it for a clotting problem, aspirin is not enough. So make sure you're not going off of something your doctor recommended without talking to your doctor. Yeah.
For PIP for thin lining, how many sessions do you recommend 1 month before an FET?
1. Easy.
Easy.
Gimme.
Have you ever seen or heard of a euploid fetus having contradictory results in the NIPT?
A euploid or an aneuploid?
Euploid.
I've never seen it. I've never heard of it either, although it is possible. Remember that nothing is guaranteed, right? Nothing's 100%. It's Canada. The only things that are 100% are death and taxes. So, nothing else is 100%. So yeah, it's possible. I've got a crown now.
You're just on. It's
There's
like
a whole new thing going on.
it's like
for
dress up
us
today. Does the long Lupron protocol work well for women over 40?
Whoa, no. That's a terrible protocol for women over 40. As a general rule, it's quite suppressive. So in the absence of you having endo, there's very little reason to do that. So I would generally avoid that if I could.
High uterine NK cells, how much prednisone plus intralipids, Plaquenil necessary?
25 milligrams. Plaquenil is helpful, but it may not be necessary. Intralipids, we do 5 to 10 days before the day of, and when you get your positive beta, and then every 6 weeks.
What's going on here?
I don't know, there's a ton of
We got going through here. How long after coming off hormonal birth control should it take for AMH levels to rise?
6 weeks, 2 months.
What would you say to a doctor who won't treat urinary plasma because bacteria is normal?
Say that again.
What would you say
Yeah.
to a doctor who won't treat urea plasma because, quote unquote, bacteria is normal?
That doctor doesn't know microbiology. Ureaplasma is not part of the normal flora of the vagina or the uterus, so that's not normal. Jen just says she had heart palpitations and noticed a little bit of spotting. Is that normal? Spotting in pregnancy is never normal. It's not always risky, but it's never normal, so you should get checked out always.
I have sky high blood pressure every appointment with Dr. Victory after we finally conceived. I was so anxious.
Yeah, it's pretty normal to have anxiety. That was from the person that talked about anxiety before. Yeah, it's pretty normal to be anxious coming to your appointments after you finally conceive, because everybody was so traumatized getting there that they're worried something's going to go wrong. Sally Kim, should I freeze my eggs in my late 30s? Depends how late into your 30s. Keep in mind that when you're 35, you need 15 eggs to get a 70% chance of a live birth. By the time you're 40, that number is getting closer to 60. So you need a lot of eggs frozen in order to achieve one live birth when you're freezing eggs. It's very different from embryos.
Inositol versus mayo inositol. Any differences, and is it only for PCOS?
Stall should have D-chiroamino in it. And it's a good anti-inflammatory, but we mainly use it for PCOS. Jen's asking if she should go to the hospital. Jen, I cannot tell you what to do medically on a show like this, but if you are worried or concerned and you have spotting, as a general rule, we always recommend that you have investigations to make sure that there's nothing wrong.
Hi team, I was listening to a fertility podcast the other day that said that folic acid is actually the only type of folate shown to help prevent neural tube defects. And that methfolate L5 actually has not been studied.
Right.
Is this true? If so, my parental from NFH doesn't have folate. My prenatal from NFH doesn't have folate in it. Should I add in a folic acid?
Yeah, so they get converted back and forth, so it doesn't matter which one you take. But that's true. The data only demonstrates folic acid, but 5-methyl and folic, get converted back and forth, so it's not a big deal. You can take either one.
What does incomplete for viscosity indicate on a semen analysis? We were inferring potentially high viscosity, and what can this mean for fertility? Is this treatable?
For fertility or fertility?
Fertility, is. Oh. Looked like fertility.
Yeah. So what does it mean? It means you have high viscosity. So it's a thick ejaculate, which can slow down the motility or make it more difficult to get through your cervix. How can you fix it? Mucinex, guaifenesin, I can never pronounce that chemical. But Mucinex will thin it out. Make sure your partner's drinking lots of fluids. Make sure he's not smoking, drinking, using any drugs, and ejaculate frequently every day or every 2 days. And will it impact fertility? I mean, if it stays thick, it will, but there are easy ways to fix it. IUI is another one.
What level should progesterone be at heading into transfer for those with endo?
In U.S. units, 45, and in Canadian units, close to 150.
Medicated FET worked previously, estrogen, PIO, and vaginal progesterone. Natural FET, only cortisone, 8%, failed embryo, didn't implant. Should I move back to medicated protocol as it worked before?
No. I mean, I would need to know a million other things about you, but one failed embryo transfer or one successful embryo transfer does not mean that that's the right protocol for you. So, no, there's a lot more to it.
Do you have to use fragment for a homozygous PAI4G mutation?
Yes.
Yes. 2 months of Lupron,
Yeah.
waiting for period to return to do a modified natural FET.
Okay.
Ari said no letrozole. What are your thoughts? Does waiting for a period decrease effects of Lupron?
If you wait long enough, yes, and your RE is wrong about about no letrozole.
Currently, 18 weeks, 4 days pregnant via IVF.
Okay.
Been having high BP over 140 over 90, chronic headaches and protein in urine, and being dismissed as not preeclampsia, as not far enough along. What else can it be? Preeclampsia.
Well, I mean, by definition, it's preeclampsia, but that is very early at 18 weeks. Chronic kidney disease. It could be a nephropathy-based problem, but that definitely requires evaluation. So no one should be dismissing you if you have high blood pressure and you're spilling protein. That's very concerning if it's already happening at 18 weeks. You need to see a high-risk specialist ASAP. Or a better OB. Sorry.
How soon after giving birth can someone try to conceive baby number 2?
Well, ideally you breastfeed for at least 6 months. After that, you can try.
What is your preferred FET protocol?
Oh, letrozole. Well, we use Lupron first, cycle day 21 of the preceding cycle. Then letrozole, lots of supplements and vitamins. Wait till the lining's 8 millimeters. Use little or no estrogen if possible. When you hit 8 millimeters, double progesterone vaginal and injectable. Monitor the level. Adjust, make sure it's in the right range, and then do your embryo transfer. Lots of vitamins and stuff. Smile, Habibi, smile.
There you go.
Yeah, I'm smiling. What is urea plasma infection? On average, how many rounds of antibiotics are needed to cure it? So urea plasma is just a bacteria. In the animal world, it causes miscarriages, and that's well established. In humans, we think it does, but it's not so well established. In terms of how many rounds of antibiotics, ideally one, but it's really hard to get rid of. So sometimes we have to use a lot of antibiotics for a long time to get rid of it.
And on to YouTube.
Oh yeah, sure.
Have you ever seen or heard of an euploid fetus having contradictory results in a NIPT?
They asked us that.
Are you still recommending rapamycin treatments for endo patients prepping for IVF?
Yes, 100%.
100%. What tests you order for a recurrent chemical pregnancy loss?
Well, same ones I talked about for recurrent pregnancy loss. So I answered that one earlier in the show. Just go back. But we do extensive testing on both the male and the female. So if you just wait till the show's over, you'll be able to go back and watch it about 5 minutes ago.
Hi, Dr. V. Why does HCG levels need to be 0? Hold on, I moved. Starting injections for IVF. Before starting injections for IVF.
What needs to be 0?
HCG levels need to be 0.
Be pregnant and go into an IVF cycle.
That makes sense. That's a good one.
Yeah.
Yeah, that makes sense.
Yeah.
I'm in bed right now.
Okay. You're sitting on my couch right now.
Yeah. For those that don't know, I am sitting on the couch. This is on behalf of a watcher, a patient. Okay. That's it.
I'm in bed right now.
I'm in bed right now.
Okay.
After just having a lap this morning after BCL6.
Yeah.
H score of 3.6.
Okay.
My doctor found 0 endo.
Yeah.
Can endo be microscopic? I am baffled due to my history of multiple chemical pregnancies. I do have 2 unassisted live births. RPO workup shows nothing. I am now 38, but this started years ago. It can't just be my egg quality, but I understand it could be the problem now. AMH is still good, 6.28, AFC 24 plus.
Whoa. Yeah, BCL6 is useless. I'm shocked to hear that someone used it to determine if you should have surgery or not. That's absurd. It's been proven to be useless as far as being predictive of endo. So I'm sorry you went through all of that. Not that I would have disagreed with doing a lab, but not based on a BCL6 measure. I've never measured it and I never will. The studies are very clear that it doesn't work. With regards to can endo be microscopic, yes, it can be. Although arguably if it's microscopic to the point where there's no evidence for it, how much of an impact does that have? Who knows? And then lastly, come and do a consult with us because usually we can figure out what's wrong.
What can cause one not to respond to stims?
Suppression. If your hormones are overly suppressed. Extremes of weight, high or very low. Excessive stress. If you're suppressed from being on some medications for too long, like testosterone for too long, that'll do it too. Even birth control for too long can do it as well. So yeah, there's a whole bunch of different things that can contribute.
From Instagram, do you recommend DHEA for egg quality?
Yes, although it's less likely to have an impact on quality and more to have an impact on egg number. But there are some studies which say it increases live birth, not enough to be convincing, but enough to think that it's worth trying because there are very few side effects.
Thoughts on thyroid antibodies? Any recurrent pregnancy loss?
Well, it depends on who you believe. Much of the literature supports that thyroid antibodies do alter recurrent pregnancy loss, but there are studies that say that that's not the case. I definitely look for them and we reduce them in our patients. And knock wood, we have a low level of recurrent pregnancy loss. So,
do you generally recommend exploratory lab for unexplained infertility cases?
Yes, I do.
How interesting.
Yeah.
How much vitamin E should we take daily?
Between 400 to 800.
Is a lining of 7.4 acceptable for an FET?
Acceptable. We'd like it thicker, but it's acceptable.
Is it true that you need
I
lactobacillus
feel like I'm being grilled
crispatus
Crispatus?
for
Yes.
success in plantation?
Yes. That's true.
Thoughts on thyroid? Oh no, sorry. I have confirmed minimal endo, lap on August.
Okay.
Lupron depot only, no letrozole from July to September.
Okay.
Blind start to FET in October. Loads of estrogen use, 2 times, 100 patches, and 12 milligrams. Failed
Oh my God.
FET.
Wow.
What now?
Come see me and leave whoever did that to you. I don't know what else to say. Like, go see, okay, it doesn't have to be me. Go see a fertility specialist that understands that if you got turned off with Lupron and you didn't fully because they forgot to use the letrozole, but whatever. They operated, they used the Lupron, hallelujah, at least they kind of knew what they were doing. And then they gave you tons of estrogen that they flipped the on switch back on. But like on switch, off switch is not quite what's happening here. You took a dimmer switch and you cranked it 4 times past what it was before. It's just insane that people do that. It doesn't make any sense. I can't handle it when I see stuff like that. It drives me crazy.
Is the fertilizers microbiome as reliable as mLNALIS?
No, it's much better than mAnalysis. mAnalysis are not nearly as good as the fertilizers test. That's why I don't use
Thoughts
them.
on thyroid antibodies in
Yes.
recurrent? Okay. Does Lupron affect prolactin levels?
Yes, it can.
How much curcumin do you recommend for someone with endo?
60 milligrams.
I don't know why the questions are one-word answers with you today. I'm mesmerized by it.
But at least we're getting through.
Oh yeah, 100%.
Yeah.
Is it better
Yeah.
to transfer lower graded day 5 embryos or higher graded day 6
Higher graded
embryos?
day 6.
They are untested.
Higher graded day 6.
And you have your answer.
There you go.
Hi.
Hi.
What retrieval and fresh protocols do you suggest for someone with endo and high NK cells?
It's a long answer. Okay, so stim, you can use Bizan for 3 months prior, or rapamycin, or both, and then do a stimulation protocol as you normally would, double trigger and so on. Once you've got the embryos made, the FET protocol is 3 months of Lupron and letrozole plus minus surgery, then letrozole based protocol, minimal to no estrogen. We really do go over this over and over again.
It's a famous protocol.
I know. Injectable and vaginal progesterone, high dose. You want to get your levels up. Make sure they measure them after 3 days. Sirolimus, steroids, and intralipids as your immune protocol, or tacrolimus. And then use all 5 supplements: NAC, curcumin, coenzyme Q10, resveratrol, and ALA. That's our protocol. Plus all your regular vitamins.
Do you ever do an FET on a thin lining?
Yes. There was 1 or 2 before that too. We missed a bunch.
What is ureaplasma
Oh, we did
infection?
that one.
Should I go to hospital? Blood pressure? We did that. How about having low blood pressure? Is that normal? Low blood pressure.
Is low blood pressure normal in pregnancy? Yes. In the first trimester, your blood pressure tends to drop down quite a bit.
Okay, those are all of those pretty good. Does OHIP cover any diagnostic testing you do for recurring pregnancy loss? What sort of dollars to expect?
It covers the swabs for ureaplasma, but that's not nearly as good as the Fertility test. It'll cover your saline infusion sonohistogram, and it'll cover your thyroid tests. It'll cover some vitamin levels, not all. That's pretty much it. So how much would you expect to pay? The fertility testing that we do is about $1,700-$1,800 Canadian. And then thrombophilia screen, most people get through their insurance, but if you don't, it's about $700. Karyotyping's free, but it does take forever. And sperm DNA fragmentation depends where you go. I think we charge $200. So we're not that expensive. Most places charge $3.
Is a second round of ovarian PRP beneficial?
Yeah, we don't know. There's one study that says that it is, so we don't know. We're still trying to figure out if one round is beneficial. Yeah.
Thoughts on mosaic embryo, low level 5?
It's considered normal now. So the conference in New Orleans, American Society of Reproductive Medicine, the biggest fertility meeting in the world, was very clear that mosaic embryos have the exact same yield of a normal baby that a normal embryo does. So we're not even going to report them anymore. We're telling Cooper to tell us normal or abnormal. That's it. We don't want to even tell patients anymore about mosaics because it's a waste of time.
What can cause uterine adhesion? No history of pregnancy, DNC, IUD, pelvic infection, normal period, but chronic thin lining.
Infection would probably be my number one thing I would be thinking of. Yeah.
What can incomplete result? Oh, we did that.
I got to answer a curly question.
Go ahead.
What do I typically eat for breakfast and lunch? So breakfast I very frequently don't have, except for Fridays, which we call Bagel Friday because I buy the office bagels.
Well, is that what happens here on Fridays?
On Fridays we have Bagel Friday, yeah. Yeah, except my staff all know that I only like the cinnamon raisin and they steal all the cinnamon raisin. And then lunch, I tend to eat a lot of freshy salads and I'll buy one and I'll split it in half and I'll have one half one day and the other half the next day. And it's actually a vegetarian salad. It's really good though. But I think they took it away. It was the bamboo. I don't think it's available because today I tried to order it and it
wasn't going through.
No, and then I went to their menu to redo it.
Gone.
Doesn't exist.
Bamboo shoots are gone.
I'm gonna kill myself. I love that salad. It's a good salad.
Let me tell you, food these days.
I ever got you one.
Bamboo shoots?
No, bamboo salad. It's called the bamboo bowl.
The bamboo bowl.
At Freshie. Did you ever try one?
The bamboo bowl?
Like with green curry sauce in it?
No, I didn't have that.
Oh, it was good, man. It was really good.
What are your thoughts on excision versus ablation surgery for endo?
So, ablation versus excision has been proven to be the same unless you have deep infiltrating endometriosis. Now, that's true of everything superficial. If it's DIE, you got to excise it. And if you have cysts of endometriosis, an endometrioma, you definitely have to excise it. Everything else is unacceptable.
What?
6 minutes.
Oh wow, 6 minutes. Oof. Hold on. Let me get some here.
Yeah, and I'm still on Brussels time, so I'm falling asleep.
You're
fast.
falling. Okay.
I'm fading fast.
Get ready.
I'm ready. Fire.
So thankful for your advice and willingness to educate from someone in the U.S.
Oh, awesome. You're welcome. Thank you.
If I cannot have twins because I'm under 5'2", and under 100 pounds, should I not do IUI?
Oh, that's a great question.
Is there a rule about twins in height?
No. But, I mean, that would be a lot on her body.
Oh, I see. See, that's why you're the doctor.
That's a great question. You know, no one's asked us that before.
Even when I read the question, I didn't even understand the question.
So I guess my answer to that is you certainly could have twins. It may not be something we would endorse or recommend, but I mean, if you naturally got pregnant with twins, no one's going to run off and tell you need to terminate one of them. So yeah, I'd probably be okay with you doing IUI. And then the other thing is, even with IUI, you can't have them retrieve the extra eggs and get rid of them. So if you need it because of your partner's sperm, it's not an unreasonable thing to do, or just use letrozole. With letrozole, it's a 5% chance of getting twins, so that's not bad.
My fertility journey did suck, but thanks to you, we are now a family of 3 and soon to be 4. Hey.
Yeah, dude. That's the video you released today.
That's right.
Yeah,
that's a direct
awesome.
response.
Yeah. We made that post because it's going to be our ad on YouTube. So, yeah.
I started ovulating 4 hours before egg retrieval, 36 hours. Timing of medication issues or both?
It happens. It's rare, but it does happen. I would be wondering if there was evidence from your hormone testing on the day of your trigger that you were already beginning to surge, in which case that's a problem.
Most common cause of recurrent pregnancy loss between 5 to 6 weeks.
That's probably shifting. Once upon a time, we would have blamed it on genetics or something wrong with your uterus, but nowadays it could be sperm DNA fragmentation. Like, we're finding out more and more, right? It could be infections in your uterus. There's still the possibility it's a uterine malformation. Egg quality can be a problem. Endo is now thought to be a culprit in miscarriages. So who knows? I mean, we'd have to talk to you and see what your symptoms are.
Anything to help get pregnant with endo?
The 5 supplements, if you're just trying naturally. The ones we talked about all through the show.
A lot of semen analysis question. I don't know why.
It's going to be a different show tonight. You getting that vibe?
Oh, yeah.
Lots of quick, boom, boom, boom.
They're in and out.
It's crazy. Yeah.
Chances of conceiving naturally after excision surgery for stage 4 endo and varicocele surgery improved. Really?
Yeah, that was ages ago.
That must have came out somewhere.
Could a uterine septum cause a miscarriage? Yes, definitely. There's some evidence that suggests that it can't, or that repairing it doesn't help, but honestly that's nonsense because I've done it 1,000 times and it helps. So there's definitely evidence that a uterine septum can increase your risks of miscarriage.
Has anyone ever been tested for immune issues and the test came back with nothing wrong? It seems like everyone needs IVIG.
Oh, I wouldn't say that. I mean, I have virtually no one that I need to give IVIG to. So, no, we have lots of people that don't need IVIG. But I will agree that if you test people enough, you will find something. And it was my argument way back at the beginning when we started working with the Alan Beers lab. I mean, they were checking you for, 100 different things. Statistically speaking, you have a 5% chance of showing up with something. So if you get tested for 100 things, you're going to show up with 5 that have something abnormal by chance, just random chance. And so, I mean, we don't know what the impact of that stuff is. So it is overcalled probably, but I mean, we're screening for a specific set of things with the stuff that we test for, and I'm comfortable dealing with those.
My RE said, ready?
Oh God, not an error test.
No.
Okay.
But, I like starting off with my RE.
Okay.
I feel like controversy is about to happen.
Oh God, here we go.
My RE said, I need to get pregnant within a year. Would be my best because my AMH is 1.3.
Okay.
I'm 32.
Okay.
Does this mean that after a year or so, I'll be way lower? No, it doesn't say. It just left it at 1.3.
So if you're 1.3 nanograms, that's not terrible. It's reasonable, actually. So I wouldn't say you have to get pregnant in a year. If you're 1.3 picomoles, you literally have no time. So I need the units for your AMH.
Her RE might be right.
Her RE might be right. And it's 9 o'clock.
One question.
Okay.
People say they like your rants, Dr. Fee. Just so you know. No one's complaining about your rants.
Carly is asking if we can see high school Rahi.
Oh, wow. You know what?
I'm not sure what that means.
A photo from you in high school.
Oh, my God. I'd have to dig out the...
yearbook.
The yearbook.
Yeah.
Oh, I was a toothpick. I mean, I was... When I graduated high school, I was, roughly speaking, 45 pounds less than I am now. So I was like super, super, super skinny. Otherwise, I actually look very similar to when I did.
Oh, is that right?
Yeah. Very similar. Yeah, I'm a lot grayer. That's about it. Okay, and wrinklier and fatter. Listen, I hope you guys have a lovely evening.
A lot of positivity in that last little comment there.
I hope you guys have a good night. Thanks for watching. Watch for our upcoming double video where I'm going to actually admit that I was wrong, because I was wrong about two things. And not so much that I was wrong, but rather that the evidence changed. And so what we originally thought is not actually what it looks like it is. So we'll be bringing those to you in a YouTube video, and probably a TikTok and the Instagram. But keep watching the show. Keep telling everybody about us. And thank you so much again for the lovely gifts and the messages you all send, saying thank you for listening to us and then getting pregnant, which is like a super feel-good moment for Tarek and I. I think I can comfortably speak on both our behalves.
Especially for me, to be honest.
Yeah.
You know, like I feel great.
Your fledgling IVF, practice there.
I am, absolutely.
You know what? It's pretty awesome that we started this show and 4 or 5 years ago just to help people avoid spending money for stuff that was nonsensical, like double IUI, which was literally the whole motive behind the show. And then now we've had, like, I've lost track, probably hundreds of people who got pregnant just from watching the show. I mean, I think that's phenomenal. And those are all amazing people that struggled, and then something just clicked and it worked. So God bless you all. Thank you so much for watching, and 100 million thanks to my very lovely friend who gave me this enormous box of chocolates. Despite Tarek's diet, I am going to have some now. So have a good night, guys.
Hello from Korea right now, just so you know.
Someone's watching from Korea?
Yeah.
You're kidding.
I swear to God.
Oh my God, that's wild. Hello to Korea. We're actually signing off. But because you are watching all the way from Korea, please DM me on Instagram.
I have a question. You want to quickly
Yeah,
from
sure.
Korea?
I'll take a question from Korea.
What is the success rate for 40 with PGTA past blastocysts?
If it's a genetically normal embryo in our clinic, 82.3%. But if you look at the literature, it suggests on average it's more like 40 to 50%. So it depends on what your clinic is doing and what the rest of your history is, but it should be a very, very high chance. Korea.
Yeah.
That's wild.
Korea. I figured I had to interrupt.
That's totally wild that we're all the way out in Korea. We have not had anyone watching us from the Orient.
No,
yet.
we have not.
That's pretty cool.
It made my day.
Dude, we did it. All right, guys, have a good night. We love you all. Jackie from Platinum. Oh, Jackie, hello. How are you? We're going to be signing off. I'm sorry. But thank you for joining us, Jackie. That's from Platinum Surrogacy, our very dear friends. They're amazing. And if you need a surrogate, please consider Platinum. Have a good night, guys. We love you all. See you next week on Fertility Factor.